State Senator Eric Lesser joins us in studio. Let's go on the record. He's challenged Governor Baker on the vaccine rollout and became a leading voice for progressive policies on Beacon Hill. Could he also be a contender for the state's top job? Let's go on the record.
From WCVB Channel 5, the inside word from Washington to Beacon Hill. Today's newsmakers are going on the record.
Welcome to OTR. I'm Janet Wu. Ed Harding is off this week. Tomorrow, Patriots Day, all state residents 16 and older will be eligible for a COVID-19 vaccination. Here in Studio C, we continue to follow all social distancing protocols, and we look forward to the day when we can be closer together. At the center desk this morning is State Senator Eric Lesser. He has represented the 1st Hamden and Hampshire district in the state Senate since 2015. Welcome back to OTR, Senator.
Thanks for having me, Janet.
And I also understand that congratulations are in order that you have just become the father of 3 within the last few days.
Thank you. We welcomed little boy David about 12 days ago. So he weighed in at 9 pounds. So he's got a very brave mom who did a great job and 2 very proud big sisters. So just catching up on sleep.
Well, we thank them all for letting you come in to do the show.
Thank you.
Let's get to it. You were a very vocal critic of Governor Baker during those initial weeks of the vaccine rollout. While folks still struggle to get appointments and portals are more stable and supply appears to be the biggest hurdle, do you think Baker has done a good job of recovering from those initial days of chaos?
Well, there was frankly, Janet, nowhere to go but up. And I would just say we acknowledge that the supply is not in the governor's hands. It's not in the state's hands. We understand that the supply is really we're at the mercy of the federal government with the supply. But what the state here in Massachusetts just absolutely does control is the quality of the website, the quality and the ease of the booking procedures and the guidelines that allow people to get signed up. And there we were very slow. We were objectively behind many other states. The Belfer Center, for example, gave Massachusetts an F, gave West Virginia an A. And where this played out in my communities in Springfield, for example, I had dozens of people calling my office in their 80s and 90s who were told to wait in the snow outdoors in Massachusetts in the middle of winter for their shots. That some were there, some were not. The bottom line is the rollout was messy. It lacked coordination. It lacked clear communication. And as a result, it slowed the ability of getting shots into arms.
But you acknowledge now that things have smoothed out because, quite frankly, no one had ever gone through anything like this. Could this be just, initial experience that could be expected?
It went beyond mere hiccups. Look, we're of course going to give everybody the benefit of the doubt in an unprecedented situation, and the legislature has given the governor really very broad, unprecedented authority, both in terms of legal authority and financial resources over the course of this year to do what he needed to do to confront this pandemic. But for example, he was asked, will the website be ready for 1 million new registrants, 1 million new eligible people? He said yes. We didn't say yes. Nobody else said yes. He was asked, will the website be ready? He said yes. It crashed. We then found out in the COVID-19 Oversight Committee that I'm a member of that the vendor, PrepMod, that was in charge of that booking software was never told by state officials that 1 million new people were going to become eligible. We had the chief technology officer for the Commonwealth, a cabinet level official, somebody who reports directly to Governor Baker, tell us at our oversight hearing that he was essentially not in communication with the COVID-19 task force before the website crash. Now, after the crash, they did snap into gear. They started signing contracts. They brought in experts, and the system is better. But we weren't asking for the Apollo moon landing here. We were asking for a website to work and for people to be given clear and consistent information. Many other states, including states with far less tech and healthcare infrastructure than us, had pre-registration systems, had call centers ready to go from day one, and Massachusetts did not.
Let's talk about the stumbling blocks that are still ahead of us. How damaging is the halt in the Johnson & Johnson vaccine? More importantly, is it really possible for the governor to convince people to get the vaccine in the weeks and months ahead?
Well, I think on that, we're going to be united in terms of trusting the science and listening to the advice of, the very significant and well-trained experts who are in charge of making sure that that vaccine is safe, including our federal partners at the FDA and the CDC. We're going to take our lead from them. I think here in Massachusetts and nationwide, it's important to point out that only about 3% of the dosing that was happening over the last several weeks was from the J&J vaccine. Moderna and Pfizer Pfizer are the overwhelming majority of the doses, and there does seem to be a very steady supply of those two. So it's of course cause for concern. We'd rather have 3 vaccines to use than not, but we're going to follow, of course, what the FDA and CDC are saying is safe.
I don't know if have you been vaccinated yet?
I qualified medically under the expanded criteria earlier this week, and I've gotten my first dose. And I went online on CVS, and it was a fairly straightforward process, and I got my dose at a CVS in Springfield.
If you had not yet had that vaccine, would you get the J&J vaccine if it's put back into the lineup?
If it's put back into the lineup and the FDA and the CDC says it's safe, of course. The same way they've said that Moderna and Pfizer are safe, I'm going to follow the advice of the experts at the FDA and the CDC.
Last week, Governor Baker said on OTR that money in Biden's plan for Amtrak is best spent on lines where Amtrak already owns the tracks and where most passengers already travel. In other words, the money lines. This sort of runs counter to your proposal for a new east-west line from your end of the state. Why is Governor Baker wrong?
Well, I would challenge that, frankly, because actually the map that Amtrak put out, which is showing the routes that they would be able to serve by 2035 if the Biden infrastructure plan is put in place, includes that inland route. If you take a look at that map, it includes the route connecting Boston to Worcester to Springfield, and of course then connecting those cities to Hartford and New Haven and into New York City. That would be transformational for our state. Look, the biggest challenges we had going into coronavirus are going to remain some of the biggest challenges we have coming out of coronavirus, which is a housing market that is out of control. I look at the prices. I mean, I live in Western Mass where it's a little bit less expensive. I don't know how anybody affords to live in the Metro Boston area. We've got backbreaking, soul-crushing traffic. We've got an MBTA that's totally overloaded. We need to invest in rail. Connecting the western part of the state with the eastern part of the state lifts everybody. It helps reduce housing prices and congestion in Eastern Mass. It helps connect Western Mass to the red-hot economy you've got in the Metro Boston area. And it's part of the Amtrak plan for 2035. We need the governor to make this a priority when the federal infrastructure bill comes down the line.
But wouldn't it take a while before you'd be able to get a large number of people to actually take the line to make it a money-making proposition?
Well, I don't think the goal here is to make it a money-making proposition. There's no transit line anywhere in the country that's a money-making proposition. The idea here is to connect people to jobs, to opportunities, to reduce traffic, to reduce air pollution. Those are the goals. But what I would say is you could actually get a line up and running pretty quickly. I think people don't realize there actually are trains going back and forth between Springfield and Boston right now. They don't go very fast. They have to compete with passenger rail, freight rail, but there is a line right now, and in fact Transit Matters and other advocacy groups from around the state have laid out plans for getting service going, even in a limited capacity, very quickly. And I do think that when you have that line up and running, people are going to use it.
As Senate Chair of Economic Development, you say it's time for sports betting in Massachusetts. Governor Baker's proposal would generate about $35 million. How does that compare with the bill that you're putting together? Yeah. And where should the money be spent, if it should be spent anywhere specifically?
Yeah, so our bills are actually fairly similar. My feeling is the time has come to allow legal, safe sports wagering in Massachusetts. Within the next few months, almost all of our neighboring states will have some form of legal sports betting. Rhode Island and New Hampshire already have it. We have seen now over the last 3 years, since the Supreme Court allowed states to begin legalizing sports betting, that you can do it safely. As terms of the tax dollars, we don't exactly know how much tax revenue it will generate. So for now, I think probably the best thing to do is to reserve it to the general fund so that we can triage it to its best use depending on what the state needs at a given point, whether it's healthcare, transportation, environmental investments, those types of things.
Do you see a vote this calendar year?
Well, that's not up to me. I mean, a process has to work its way through with the other 199 members of the legislature and, of course, the leadership in both chambers. But I do think that we know a lot now about how to do sports betting the right way. We see our neighboring states having moved forward already, so I do think it's time for us to move fairly quickly on it.